Thank you all very much for joining us tonight on our Dessert with Andrew and Yvonne episode. This is not going to be your traditional webinar where it's a dry presentation where you just get information but you don't know what to do with it. We are going to talk about real life and how that is applied to an actual process in the background that keeps you safe. And we have great guests this evening, right, Andrew?
That is correct, Yvonne. I'm so happy to be back here again. It's I'm looking forward to our topic. I'm looking forward to our guests. I'm looking forward to the fact that about 30 people have already gotten in. So we're going to slow roll it a little bit as we move forward to let the people get in here. And then we're going to break into a song and dance. No, I'm not. Then we're going to break into talking more about where we're going and our non-traditional show and why I think that we have a great show. I think not only do we have a great show for them tonight, we have a great show for them all the time. But it's not your typical type of thing. It's not like people standing up, looking at PowerPoints, pushing them along and giving a whole bunch of information, so you feel like you're getting hit by a fire hose, right? So we're going to really, give some conversation. There's going to be some context to what we do. And hopefully all of you will kind of understand and learn a bunch of things too, besides having a good time being entertained. I will tell you that we are going to have a survey at the end of this, and you get a chance to tell us how good or bad we did. So you'll rate us on a scale of 1 to 10. 1 means Yvonne and I should have stayed home tonight. And 10 means we did a great job, and you guys really, you got relevant information.
10.
Like Yvonne says, if you have no time, just fill in all the 10s.
Absolutely. Thank you very much, Andrew. And thanks again, everybody, for joining us. I know we're all, everyone's kind of getting on and logging on and showing up on the screen. So we are really happy and really glad that you are all here. As usual, or again, we have giveaways from local community businesses. And what we will be doing in the middle of the show is we will be giving out gift cards so that you can show your support to our local businesses. Beacon, as well as Andrew Gelosa, we are big supporters of small businesses. I will talk to you about the businesses that we are highlighting tonight. Dough Donuts gave us very, very delicious, scrumptious donuts yesterday at our office, so we really appreciate that. They're located. Oh, darn it! We forgot to take them over to you yesterday, Andrew.
Yeah, this is Dessert with Andrew and Yvonne.
Okay, next time okay. You'll get the donut.
Right,
well, I missed the donuts the first time, though. You got the donuts the first time.
Yeah,
so. Okay, but they are located at 2170 31st Street in Astoria, and we would really love if you guys would stop by and grab some donuts and coffee. The next business that we are highlighting is Grand Florist, which is located at 6537 Grand Avenue, and they make very beautiful arrangements. We have a gift card for them. We have a gift card for Dough Donuts and Good Eats, which is right there in Maspeth, Queens, right across the street from Beacon Elder Care. They were generous enough to also donate a gift card for tonight's show. So we want to thank them, and we want to just push everybody to shop and go and buy at your local community businesses, because that is how the economy survives. So now when we get to the middle of the program, we will ask you to enter a number between 1 to 10, and that is how you will be able to win our gift cards. Andrew can explain that a little further.
Absolutely. So when we give you the prompt to enter your numbers, please do so. Choose a number between 1 and 10. The first one who matches the numbers that we choose will be the winners. We'll be announcing what those numbers are sometime later in the show, not in the middle of the show. And we're not going to tell it to you by mistake either, because I'm not going to say it again.
Oh, I think somebody gave the numbers away last time. Her name might be Yvonne, which is why I don't know the numbers tonight. That's okay.
Right. Exactly. So what will happen is once you choose those numbers, we will see who the first one to choose them is. We'll contact you by text. Expect Tiffany from my office to contact you. She'll contact you and ask you for your contact information so we can make sure we get you gift cards. We understand that last show, there was one or maybe two people, I don't know, who did not get their gifts. that was because we didn't have your contact information. So if you are the person who was the person who won last time, please, we know who that is, by the way. So please contact us and make sure that you give us your contact information too.
Okay, great. So someone, Patricia, she just said, please repeat, I just joined. Well, hi, Patricia. I don't know if we'll be able to back all the way up, but we explained that we're going to do a giveaway in the middle of the show. And at the end of the show, we will make an announcement or who picked the numbers. So that's your recap.
You'll pick a number between 1 and 10. The first one to match the number that we gave will be the winner. There'll be 3 prizes. And then you'll contact Tiffany to make sure that you tell her that you were the winner. Tiffany will know who's the winners because we'll see the chats. And so we need to get your contact information in order to get you your card.
Okay, great. Thank you, Andrew. Now, on to the show. I am excited to introduce my co-host this evening, Andrew Gelosa. And Andrew Gelosa has been practicing law for over 30 years. He's a member in good standing of the Bar of the State of New York, the New York Bar Association section on trusts and estates and special needs, a member of the National Academy of Elder Law Attorneys and Lawyers with a Purpose. He has lectured on estate planning and real estate topics to audiences in New York City and the surrounding areas. As CEO and principal attorney to the Estate Planning and Elder Law Group, Andrew Gelosa takes pride in helping families prepare for their future. He specializes in assisting families with preserving their generational wealth and passing on their legacy that they have spent most of their lives building. Mr. Gelosa and his team help families achieve peace of mind by developing personalized solutions so they can maintain control when they are at their most vulnerable. They achieve this by listening with empathy to each client's situation. Their planning leaves their clients feeling safe that their future and their family's future are protected. Thank you very much, Andrew Gelosa.
Oh, thank you so much, Yvonne, for all those wonderful accolades and words. I appreciate it. Thank you. Yes, Andrew Gelosa from the Estate Planning and Elder Law Group. I've been practicing for over 3 decades. Right?
Wow.
That's amazing.
Mm-hmm.
Yeah,
you don't look it. You look so young.
Oh, thank you so much.
You're welcome.
I love you too. And I appreciate all of you for coming today because you probably have a lot of things to do, and coming and hearing us speak and entertain yourself this way with us is really, really an honor. So it's great to do that. We have a great show today, and I'm going to tell you a little bit about the Estate Planning and Elder Law Group. What we do in our office is, as Yvonne says, we provide peace of mind. So most people don't really know what happens when things go wrong in your life, and we help explain that, educate people in the public and our clients as they come in to understand what happens when things go wrong, talk about the benefits of being prepared and making sure that people put plans in place so that when things kind of slide off the cracker, you have some plans in place so that you can know that the best possible outcomes will happen. Without any planning, what happens is the government decides what happens to you. We put you in the driver's seat. We make sure that you stay in control of all those things that you've worked so hard for your entire life to build up, and make sure that it goes to the people you want to, when you want it to go to them, and how you want it to go to them. So we've been doing this for many years. We help people we are a full service firm from estate planning to elder law to real estate, asset protection, and what we do is we help families. So we're located on Myrtle Avenue, 7127 Myrtle Avenue in Glendale, New York. Our telephone number is 718-514-2066, and you can reach us at info@aljlaw.com. That's aljlaw.com. And thank you very much, because I thank you for listening to me, and I'm now going to introduce my great co-host, Yvonne Murphy. Yvonne Murphy is the founder and CEO of Beacon Elder Care, a New York licensed home care agency, and Beacon Geriatric Consulting Agency, the consulting arm of that agency. This agency services New York's 5 boroughs, the Bronx, Brooklyn, Manhattan, Queens, Staten Island, and also Nassau County. Ms. Murphy's educational and leadership background is quite impressive. She's received her first master's degree in social work from Adelphi. and continued her graduate studies to acquire a second master's degree in forensic psychology from John Jay College. That powerful combination of social work and forensics uniquely qualifies her and immediately differentiates her from other executives within the home care industry. With more than 20 years of experience with long-term care, healthcare, housing options, consulting and supporting families who are caring for elderly loved ones, Ms. Murphy is known to be the champion of innovative and diverse care plans for those with special needs. Since 1995, Ms. Murphy's name has been synonymous with successful positions of leadership and care in major New York City hospitals. Yvonne has garnered a professional contact network, which she established to serve and provide the most up-to-date healthcare information. And with no further ado, I give you Yvonne Murphy.
Wow, thank you for that. That was a nice introduction. So, Beacon has been in the Maspeth community for 14 years. We have been a proud sponsor for many local events over the years. We have strong community relationships. Beacon Elder Care is located at 6923 Grand Avenue, Maspeth, New York, and we offer home health aides, registered nurses, and case managers. We have a dedicated team of professionals to assist with patient care. We have case managers and geriatric care managers to assist with community paperwork and recertification of documents. Beacon is bilingual. We speak Spanish, French, Punjabi, Cantonese, Mandarin, and Polish. So we really have a diverse group of employees that we can service a diverse population of people in the community. So what is home care? Home care enables older adults to age in place in their own homes, while professional caregivers help them with the daily tasks they need to maintain their independence in the home that they desire. Home care played an integral role during the pandemic. I like to say that the home health aide was the arms and the legs of the doctors because they had a front row seat to give information about safety, issues, and concerns in the home. This is why a show like this evening, is so important. It puts a spotlight on the way the universe has changed with service delivery. So I'm glad Andrew and I are here today to bring and spotlight some of those things. So Andrew, you want to introduce our topic for tonight?
Absolutely. I also want to remind you to please enter in your thoughts on some topics for the future. So we would like you to, this is your show, and we'd like you to give us your ideas. So please give us some topics for future shows that you'd like us to do. So today's topic is, how has the pandemic affected healthcare, home care, and estate planning? And we're also going to be putting a poll up on the screen in a moment, and we're going to ask you to answer the questions so that we get some idea of what your thoughts and feelings are on the subject that we're talking about here. So,
Okay.
and let me just talk to you a few moments about how we experienced in the estate planning business some of the things with the pandemic.
So let's get the poll up. Okay, great. So our viewers, if you can please click the box and answer the questions while Andrew talks about his topic that he was just getting ready to go into.
So we talk about how the pandemic affected us in the estate planning business. As many of you probably know, because you probably experienced it in your own lives, many people are going to get around to doing estate planning. Like they're going to get around to a lot of other things in their life. You know, there's something that they think is important. They hear about it. They're concerned. They think about it, especially as they age a bit. They think that they need to go do something about it. Well, I will tell you that fortunately for people like us, the message that if not now, when, was pretty much the pandemic message, right? Because if you don't get spurred into taking action to make sure that things are okay in your own house when this kind of world disease affects so many families, and you hear so many people getting sick, and all those things that have happened. So, we in the estate planning business always talk about this. We always talk about planning in advance because we see the great benefit of doing it. Getting things in place early really, really is very important. So in essence, the pandemic helped the estate planning business because it woke people up to what they needed to do, that they needed to do something, facing disease and people getting sick and dying around them without having any plans left them more vulnerable than usual. And many people came and started doing planning. The other side of that is the pandemic made it difficult to deal with our clients, especially ones that were in nursing homes. Going over to a nursing home and going to talk to my client in the hugging booth for 10 minutes, where you really couldn't have any contact. Not even talking physical. It was difficult to hear them. We're behind the plexiglass. They're in a weakened state, so it was really kind of difficult for us to deal with them. But just like with everything else, you kind of roll with what you have to deal with. Fortunately, the governor allowed us to do remote signings and remote witnessing for testamentary documents. So we were able to expand our ability to deal with and help people because they could do it right from their own home as we helped them. So the estate planning business was changed greatly, and hopefully some of those changes will be implemented permanently because it's really, I think, a better solution for people to be able to access their attorneys via remote and virtual, as well as coming into our offices.
Right. So, Andrew, you see the poll up on
I
the
do.
screen. You want to read
I
our
see the
results?
results, absolutely.
Let me see. What do we have here?
Question number one, do you know anyone that was badly affected by the pandemic? Not a surprise that 71% of the people here did have somebody that they know that was badly affected. Number two, do you know anyone that needed home care during the pandemic? Approximately 63%, 2/3 of the people who are attending here did know someone that needed home care. And did the pandemic change your ideas about how important it is to have an estate plan in place? Oh, warm my heart, yes.
Wow,
86%.
86%.
That is
Wow.
really great.
These
Great. So
polls are fantastic.
hopefully all of you are contacting your estate planning attorney and getting your affairs in order.
Exactly. So I'm going to just go into a little short story of my own about the pandemic. You know, during the height of the pandemic, people were very weary to let other people into their home, especially in the beginning. We weren't clear on the instructions. The general public wasn't clear on what to do. Wear a mask, don't wear a mask, wear the gloves, don't wear the gloves. So, you know, did people use home care during the pandemic? Yes, they did, because when you need assistance, just because there's a crisis outside doesn't mean that the crisis inside ceases to exist. Um, there was definitely a need. You know, fear of the unknown is overwhelming to handle, especially if you're home alone and you don't have other family members so that you can discuss what the situation is. I know Andrew mentioned the DocuSign. That was a big deal because prior to this, I don't know that people were easily able or legally able to DocuSign these important documents. I think that was a law that was put in place during the pandemic. Is that correct, Andrew?
Yes, there was an executive order by Governor Cuomo who passed pretty early in the pandemic and allowed us to witness document signing over Zoom or some other kind of video conferencing technology, and allowed notaries to notarize documents over the same technology.
Which was unheard of.
Yeah.
So.
Many things, New York is not as forward thinking as New York appears when it comes to things like surrogates work or things like guardianship and things like signing documents and notarizing. We're kind of very backwards. We don't advance into the 21st century, as quickly as some other states do.
Oh, yes. Oh, yes. So I'm glad that we caught up with the sign of the times, so to speak, so that we can get things done. Everything came to a screeching halt. We are going to go on to one of our first guests, but we're going to put a second poll up on the screen.
Yes.
And then we'll give the results of that after we have the interview with our doctor.
There we go. So we'd like you to take your time, answer the questions, and we'll come back to it shortly and go over the answers with you.
Exactly.
Yvonne will introduce our first guest.
So I would like to introduce Dr. Inoa, and Tiffany is going to get us all set up so we can see Dr. Inoa. She's joining now. Hi, good evening, doctor.
Hi, Yvonne. How are you?
Thank you so much for joining us this evening.
Thank you so much for having me.
So, Dr. Enoa is a compassionate and dependable family physician and primary care doctor at EMU Health in Glendale, Queens. Dr. Enoa earned her medical degree from St. Matthew's University School of Medicine in Grand Cayman, Cayman Islands. Dr. Enoa is part of the EMU Center team. She is board certified by the American Board of Family Medicine. She conducts her appointments with the personalized care and attention that she would expect of her own family. Dr. Enoa is committed to helping her patients enjoy a healthier lifestyle. She works with each one to discuss ways they can make better choices in their health. She is uncompromising in her dedication to the well-being of her patients. Doctor, thank you so much for joining us on the show. I'm sure studying in the Cayman Islands, that was pretty rough for you during those times, right?
It was. If I went to the beach twice, I think is a lot.
Oh my goodness. Okay, well, that's not a good part of the story, right? Andrew, do you want to go into our first question?
Absolutely. Hi, Dr. Andrew Geloza here. I'm so grateful that
Hello,
you
Andrew.
come and joined us this evening. Doctor, tell us a little bit about some of the services that EMU Healthcare Center provides.
Sure. EMU Health is a multi-specialty center. They have an ambulatory surgical center as well as a multi-specialty clinic with services including family medicine provided by myself. There's gynecological services, general surgery, orthopedic surgery, vascular surgery, cardiology, and imaging as well, including your mammography services, ultrasound, and x-ray.
Wow, that's a lot of things.
That's a lot of services. That is a full service place.
That is. Doctor, can you tell me how the pandemic changed the way that you think about healthcare?
Um, I think it brought it up to speed as far as what we expect from other services in our lives. Like we order food from Amazon or we order delivery. Everything comes to us through our technology or either our cell phones or our computers. Um, the traditional sense of going to the doctor for, mainly for things that don't require extensive, physical in-person evaluation. Um, I think that the pandemic took away some of those preconceptions that quality healthcare could not be provided remotely or via telemedicine. The pandemic sort of forced us to provide telemedicine, because our patients need us. Even though our facility was closed, I was still working from home doing, patient visits if they had internet, if they had, some access to video. I'm sorry, let me just close this. To video telemedicine, we would offer that. If they didn't, like many people just had telephone access, we would make do. And luckily we were able to help a lot of our patients and not have them go to the hospital because that was the last place anybody wanted to go during that time.
And very scary.
Exactly. Nobody knew what was going on. A lot of urgent care centers, you remember the pictures, the lines would go around the block. So for someone, especially the elderly, it was a very tough decision for family members to decide, what are we going to do? Are we going to go have them tested? Should we wait this out? A lot of times,
But
appointment.
the wait out concept was literally such a long wait, over a year. So the family members that said, oh, okay, well, mom, dad, grandma, grandpa, we'll wait this out. But it was almost, how long could we wait? So I'm glad that what you said, Dr. Enoa, that the medical industry had to catch up with the times and figure out how to provide service delivery for medical care. And we did that. So, doctor, give us an example of how your practice changed because of the pandemic. I know you were talking about the telemedicine. Did you find that the seniors were having difficulty logging on to their smartphones or logging on to electrical computers and equipment and so forth?
This is, I think a lot of people are they have different learning curves as far as catching up with technology. Some people don't have email, but then again, other people who are also elderly, they have TikTok and Instagram, and
Well,
they're
they're ahead of me. I don't have TikTok. I don't
yes.
have.
So they're very, they're able to use the Zoom, but we accommodate, and luckily we were able to keep the practice going, and open to provide those services for them. Um, even things like a blood tests. We were able to coordinate either home visits for that or coordinate with a home care agency to see how we can figure out the logistics of all of that.
I like that, Doctor. Coordinate with the home care agency. Like I said, when I was speaking and describing the home care agency and what we do, I reference my home health aides to the arms and legs of the doctors, because we're the ones that's carrying out the nutritional requirements. We're the ones that's monitoring the medication in terms of reminding them, and we're sitting in the catbird seat so that we can tell you whether or not a prescription is effective or not effective. So I'm glad that you had some insight to the fact that the home health aide is really an important part of the household in terms of keeping the patient safe.
Absolutely. You'd be surprised. I mean, these are people who they have their own families, and they were and the ones that I've come across. I mean, in the middle of a pandemic, to have your own family, but leave your home to go take care of someone else. These people went above and beyond, not only with their
Absolutely.
professionalism, their selflessness, communication wise. Everybody. Some people had my direct line because I
Oh, wow.
needed them to let me know.
Did you hear that, everyone? Dr. Enoa gave out her direct line to cut through the operator and the red tape so that she can be immediately responsive to her patients. That is exactly the type of doctor that you want to go and see.
Absolutely, no question about it. Doctor, please also tell us about an event or a person that really affected you during the most during the pandemic.
I'd have to say is the person that I actually got to meet when we reopened our practice. Um, this individual was working for the MTA during the beginning of the pandemic. In March, became ill. Within 3 days, was hospitalized in the ICU. And from March to the end of August, this person was in the ICU. They were intubated, they had dialysis, they had a gastric tube to provide feedings. Um, so many things happened to this individual, and they just kept fighting and pushing, and that family
Fantastic.
faith. And to this day, they're still the support. And my I feel like my role now, that this patient, and they were in a nursing home for a very long time.
Mm.
Imagine for 4 months laying on your back in an ICU. Imagine what the body goes through. It's a very big toll.
Yeah,
Going to a
yeah,
nursing home all the way until this year, basically. Now coming to back into society, to say, back to the doctors. Um, I love that we have the flexibility to have in-person visits when we think something needs to be assessed in person. But we have the ability to have telemedicine to assess things that can be dealt with remotely or administratively. Setting up home care, for example, is it's a very long process for someone who's been admitted and now has so many comorbidities.
yeah.
Um,
It's a
I,
great thing too that there's now the ability to have remote visits with patients after the pandemic. I'm sure it's going to just be part of a big arsenal of different types of things. And thank you so much, really, Doctor. You know, your coming here was really, really fantastic. I'm going to ask Tiffany to please pull up the results of the second poll at this time, and so we can go over them. So the second poll had a lot to do with telemedicine. So have you had a telemedicine visit with your doctor? And 73% of our audience have had that. That's pretty, I mean, it's kind of expected, but still
but
surprising.
still significant, because
Yeah,
who would have thought 2 years ago, if we put this poll up, 73% of the people would have had telemedicine visits versus going into the doctor's office.
question two, was your telemedicine experience good or bad? And 85% had a good experience with telemedicine.
That's
That's
excellent.
really great.
Very good.
Question three, and this is really wonderful too, I think. Have you gone back to in-person visits with your healthcare providers? 88% of our audience is back in person with their healthcare provider.
Wow.
Yeah, that is a surprise to me. And do you want to go back to in-person visits with your doctors? Overwhelmingly, the answer is yes. Not really sure how we got 101%, but you know, someone answered this thing both ways.
They just kept clicking.
Yeah.
So, but yeah, you know, I also want to add that a number of my clients or patients, they give their blood pressure readings electronically. That goes to the doctor's office. They also give their sugar readings, which goes to the doctor's office. I think the fact that they can provide these remote readings to the doctor's office, especially if your blood pressure is high, the doctor has the ability to be more reactive to you quicker, because now you're not saying, oh, I don't feel well, let me call the doctor, let me go make an appointment. Then I go over there 3 days later, and then he checks my blood pressure. This is a very immediate concept, and I really think that, or I'm sure that that concept will be something that stays and survives through the pandemic. So,
I think so too. I agree. I agree that you know, telemedicine is definitely here to stay. It was something that, you know, I had a project and I had some clients that I was involved with back in 1995.
wow.
We were dealing with a telemedicine product. It was right when the internet was really coming out, and it was it's called about like being a dollar early and a little too early to the party. But the point was is that at that point, it was really something that was coming around, and the use of the internet as a means for doctors, excuse me, to make, you know, to have you know, visits with patients and make diagnosis or review medical test data or things like that. It's just really unbelievable, and it's here to stay. So
Right.
I think it's time that we pick those winners.
Well, first, I want to thank Dr. Inoa for joining us this evening. And if anyone in the area or any one of our audience lives in the area of Glendale, please visit the EMU Medical Center. I don't, the doctor's off the screen now, so maybe she can type. Dr. Inoa, can you just type into the discussion bar the phone number and address of the clinic, so the people that we have on our show can reach out to you and go and make an appointment there in your excellent clinic that has many multiple services.
Yes.
Okay, so what you were saying about the poll, Andrew?
Well, first I'm going to say thank you to the doctor too for coming. It was very enlightening, and it's great to hear about the angels out there who are, you know, helping people in times of people's most distress. So that's really wonderful to hear. What I was talking about is not about
the winners, right? Our
talk
giveaway.
about the winners of our giveaway, right? So
Let's do
everybody,
it.
please pick your numbers from 1 to 10, enter it into the chat bar, and in a short while we'll come back and we'll tell you which ones are the winning numbers. So until then, we're going to put up our third poll, right? You have something to talk to?
Yes, the third poll, and then we're going to go into the two doctors that we have from ProMed Physical Therapy. So let's just get our third poll on the screen. I love these polls. I think it wakes up our audience because we need attention to click the right button. So.
And also, thank you, doctor, for putting up your information. So give Dr. Inoa a call.
Okay. All right, Andrew, can you introduce our wonderful and accomplish next guests, please?
Absolutely.
As Tiffany shows us their welcoming faces.
Welcoming faces, man.
Yes, smiling faces. You know, a smile goes a long way, I tell people. See, look, right away. There you go, Dr. Ryan Martin. How are you?
Good, Yvonne. Good, Andrew. How are you guys doing tonight?
We
Appreciate you
are
having me.
great. Thank you. Dr. Ryan Martin and Dr. Michael Macchiarulo. We're going to call him Dr. Mac because I'm not going to butcher his name the whole show.
That's what everybody calls him.
Dr. Mac and Dr. Martin from the ProMed Physical Therapy, which is they're a physical therapist owned business.
It's a tongue twister.
Expanding to over 3 conveniently located facilities, one in Glendale, Queens at the Atlas Bowl, in Kew Gardens, Queens, and Manhasset, Long Island, which is their newest location. Their facilities offer state-of-the-art equipment in spacious, newly renovated modern spaces. More importantly, ProMed is filled with skilled professionals that always go the extra mile for their patients. They have been serving the community for over 15 years and continuously strive to deliver excellent service and providing the ultimate physical therapy experience. Dr. Martin was born and raised in Middle Village, Queens, went to Christ the King, undergraduate at Columbia University, and a doctorate in physical therapy at Long Island University, Brooklyn campus. Ryan's treatment approach involves helping each patient understand their unique individual circumstances and put the power of medicine back into the hands of the people. Dr. Mack is the director of physical therapy at the Glendale location and is an integral part of the operations at ProMed, serving as the social media director and professional development coordinator. Born and raised in Maspeth, Queens, 2 local boys here, high school, Archbishop Malloy, and an undergrad at Adelphi. He has a doctorate in physical therapy at Long Island University, Brooklyn campus. I think you guys met there, and being part of ProMed for the last 10 years, from patient, intern, tech, and now physical therapist. Mike's true passion lies in his ability to connect with the individual through empathy, emotional intelligence, and treating the individual as a human rather than simply as a prescription body part. So we're going to go right into some pandemic questions, if you don't mind.
Absolutely.
So how has the pandemic changed the way that you think about healthcare?
Well, first, thanks for having us on. Really appreciate it. And lest anyone think there's any nepotism going on, Andrew and I are not related.
Okay.
Get a little confused.
You guys look alike, so much alike.
You know, we get that all the time. We get that all the time. No, I really appreciate you having us here, and we're really proud to be a part of this great panel, and add some content and be able to answer some of the questions you have. And I think when you talk about how anything has changed, I think there was a change going on. As a matter of fact, there's always change. The only thing constant is change in this world. If you
Well
ask,
said.
Thank you. But I think physical therapy way before this was at a crossroads. I think that there are a lot of options. I think there are a lot of misconceptions about what therapy is. And, you know, I still have friends call me and say, hey, my shoulder hurts. You know, what exercises do I do? And I say right now, none, because, you know, it's not about the exercises. It's about the why. And medicine today, I think, you know, we treat the body like a car. And there are some truths to that, because we do have similar body parts. But the one thing different about every car is the driver. And so we focus on the connection. And, you know, in that great introduction there, thank you, Andrew and Yvonne, we talked a little bit about the human interaction, the experience, and getting to know your patients. And I think when you look at that as an organizational set of values, we have to get to know ourselves. And, you know, there was a lot of talk about reinventing yourself during the pandemic. And I felt like, you know, we've been putting in so much work to build that culture and build the value system that we have, that I think that we were kind of prepared for this. And, you know, we don't rise to the occasion. We often fall to the level of preparation. And I think the tight-knit bond that we had, we were able to make the adjustments that we needed to. We were able to, you know, we could talk about this a little bit later, which was adjust to telehealth. And one of the biggest things, I think, was the lack of communication. We really, if you've been to one of our clinics, you see the camaraderie, the family type atmosphere. We're open. People are conversing, getting to know each other. We're community based. So that lack of that communication or that constant contact, and Michael will talk a little bit about some more of the changes that happened inside of our clinics, as he was on the quote unquote front lines of our office, especially our Glendale location, which was relevant to the area that we're speaking with. We were really able to we were losing that connection with our patients and that communication, and that was a little bit. We're never going to stop. Nothing was ever going to hold us back. We push forward. We've climbed mountains before. We've run up hills. You look back and you say, man, I can't believe we made it. And this is certainly one of those times. But the work we put in, the tough conversations, the relationships we have, I think that really helped us. And the lack of that communication, that really pushed us to find new ways to communicate and to reach out to our patients, which I think our whole staff and our whole team is really well versed in.
So, Dr. Martin and Dr. Matt, so do you think the way you practice or provide physical therapy, how do you think that has impacted the model that you currently have in all three of your facilities? The model in terms of service delivery.
Yeah, I mean, our model is really, like we said before, Andrew, and even in your group, it's really delivering the experience. It's communication. That's the biggest thing. We really pride ourselves on not a bunch of exercise, but getting to know people. You need to build trust first, and especially during this pandemic, there was a lot of uncertainty. People were afraid to come in. They didn't know if it was okay. No one really knew anything. You didn't know how close to get, if it was okay here. Do I touch this? Do I not touch that? So, in our field, it's very close contact. It's the physical part of physical therapy. So for us, we have to be hands-on. Telehealth definitely threw us for a little bit of a spin where we had to really tie in how we use our communication. So it almost made it better in a sense that we had to switch over to this telehealth part of it. And you really needed to use your words wisely because we couldn't be there with you. We couldn't hold your hand. We couldn't position you properly. So it kind of helped us out in that we realized how important communication is, not on just the team approach, but also in providing effective treatment.
Well, I'll tell you, I had my knee replaced January 3rd of 2021 and then May 3rd of 2021. But the January procedure that I had, when I was well enough to go to physical therapy, they had just lifted the regulations where more people could be inside physical therapy. And I have to tell you, it was me and two other people there. It was always very empty. And to not be able to walk through the door and have them say, no, Yvonne, point your foot down as you lift your leg up. You can't see that. You can't correct them on the screen because they just have to follow your instructions. So I definitely have an understanding and insight to what you're saying about that.
Yeah, I mean, it was like almost, I don't want to say scary. I mean, everybody kind of felt that, but when we looked around and we were like, hey, wait a minute, what's going on here? That interaction, those communication, we stayed open the whole time. There was no, when you talk about essential, we're essential for the people that need us. Like I said, we're not going to stop. We know where our passion lies. We know where our purpose is. As an organization, as individuals, these are things we discuss on a regular basis. And so, everyone was saying, be safe. And, I kind of look at it and say, what's the opposite of safe? It's sacrifice. And so you have a choice, and we have a choice to make every single day we get up, right? It's going to be positive. We're going to be negative. What are we going to lead with today? And we chose right from the start. We chose the sacrifice. We chose to be there because there was just no other option for us. We weren't going to relent, and we know our patients needed us. We have people that had surgeries 2 weeks before. We have Division I athletes, Division II, Division III college athletes that had ACL reconstruction maybe a month ago. When the smoke clears, these guys are going to be back on the field. And then what's going to happen? Does their life stop? So, telehealth, in person, we were able to stay there And, it was a little bit, kind of scary in terms of, the volume and watching something where it was so bustling and thriving and seeing everybody just smiling and improving and growing. That was tough. But, we stuck together and we were there for our communities. And we surprisingly had, I don't know, a good amount of people come out. And, I'm glad to see that poll at 88%, because, that's kind of what we're thinking, right? Where are we right now? And so from this small sample size,
I'm glad we did that poll for you.
I you know what? See, it's a double benefit here.
Yes, yeah. So our last question, Andrew, you want to go to the last question about the?
Yeah, well, the last question, then we're going to go to our third poll, which you're probably going to get some good answers from that too, because we asked questions around remote physical therapy. Please tell us about an event or a person that really affected you most during the pandemic.
Right, the silver lining story.
Silver lining story.
Yeah, I mean,
I'm going to pass this one to Mike.
Awesome, and he was getting ready to say it, so he already knew that he was going to talk about it.
Yeah,
Go team.
Kind of have two. My mother that had COVID also, so kind of saw that she had it pretty bad, and we live in the same household, so she lives upstairs from me. So just those nights of just hearing coughing and calling her on the phone, hey, everything's all right. I'm trying to help her out and in the mindset part of it. Say, Mom, come on, you got this, and then she was always like, Mike, listen, if you didn't push me, I probably wouldn't have to go to the hospital. So a patient of mine as well that I was seeing in person before, and then on telehealth had COVID and had it very bad, where his pulmonary system was very affected, cardiovascular system, and we kind of through telehealth tried to run through breathing drills and trying to build up his endurance, and saw a very big improvement. And we do a lot of at our clinic, we talk about breathing so much way before this pandemic hit, and it was even more so how vital it actually is and how we actually don't focus on breathing. It's the one thing that's subconscious that we never focus on. And if you put 1% attention to it, it could change a lot for us. So we went through that, and we really kind of made his body very efficient, where he was able to walk, basically not even able to walk to the bathroom, to walk in a couple blocks at a time. And it just shows you the impact and just the experience of it, and what you feel back, how you can still do this through telehealth. As long as you put that experience first, and you don't say, just because I'm who I am and I have my degree, that whatever I say is magic and gold. You still need to make sure that the patient's first, make sure that they understand. That's the biggest thing.
Yeah,
absolutely.
education and communication is always very important.
Andrew, you want to do our third poll results, which is surrounded around PT?
Bring up the third poll, please. So the first question was, have you had remote physical therapy or other therapy treatment? Really, about 19% only. So 20% of our population has had some remote physical therapy. Did you take part in remote exercise classes or other group events? Oh, a little bit more than half did. So that people, did experience that and understand that, that they can get that same kind of experience of dealing with getting their exercise in. And how was your experience with, remote therapy or remote exercise classes? Good, almost as good, or not good in person? Well, I have to say that most people want to be in person, right? That's, and I can understand why, because it's not just the exercise, it's the socialization and, being able to, see, feel, and be with other people. But still, most people have the experience with he's good or almost as good. So Absolutely. It still is, something to say. 48% of the people thought that was okay, and things, worked out pretty well. I think thank you so much for coming, both Dr.
Absolutely.
Martin and Dr. Mack.
Do you want to tell us how we can reach you, or give us some of your social media addresses? We've got such a great viewership right now. There's more than 70 participants on the line. So just let everybody know how they can reach you.
Yeah, absolutely. And even that poll too, on that last poll that you had, it said experience, and everybody's experience in every physical therapy office is not the same. It's always about the people. So, the people that didn't have a good experience, think why. So that's what we pride ourselves on, is really the ultimate experience, and it's not just some word, it's not just some phrase, it's what we really believe in our heart, what we do every day. So, we're right in the neighborhood. I mean, I live in Maspeth. I'm basically down the block. I'm right down.
So we expect you to stop in and say hello.
Absolutely. Come on, I'll bring you
Okay.
some Rose's pizza.
And we
Oh,
expect you to put
excellent.
your information into the chat bar so
Will
that
do.
people.
Yes, we're right
Yes.
now at Atlas Park. Yeah, we're right now at Atlas Park,
And
and we're yeah. I'll
You
put
can,
it in the chat.
yeah, please do. So
you can check out our,
thank you both doctors for coming in and enlightening us in, what remote physical therapy is and some of your experiences through the pandemic. But we're going to move on now.
Thank you, guys.
hey, thank you guys. Thanks for having
We're
us.
going to
Mhm.
move on to Beacon Healthcare, and we're going to have Yvonne is going to introduce some of her employees and talk to you a little bit about how they dealt with the pandemic, because they have some very interesting stories. And I know that John has some photos that we're going to see. And then Tiffany is going to announce the winners by putting up a screen showing our three winners.
Okay, great. So we've got some pictures from things that Beacon did during the pandemic. So John, is it going to slide or, because I don't know.
Slide the slide, John.
All right, well, in the meantime, while we get these pictures to move across the screen, I just want to say that, working during the pandemic, it wasn't easy, especially being in home care. We were considered an essential employees, so the home health aides were expected to still go to work. And okay, so here we are with the pictures. Our home health aides were expected to go to work. We had important staff that came into the office. So there's me, actually. I was home cutting and sewing masks all night long because we couldn't find any anywhere or buy any. So my daughter could sew. So we took it upon ourselves to cut and make the mask. There's Christopher Mendez in the middle. Christopher Mendez is one of our panelists this evening. He's a case manager that was in the community during the height of the pandemic, delivering, if we can go to the next slide, groceries and delivering necessary items. So we delivered diapers, chucks, gloves, face shields. We delivered suits. If we can go to the next screen. We also delivered paper towels, and we were able to shop in the local grocery store doing early morning so that we can buy groceries for the clients. When you say that there was a paper towel shortage, that was actually, we had experience with that because we bought, I think, hundreds of rolls of paper towels and toilet paper. And the stash that I thought that I had at home, I was like, okay, I've got the stash in the office to give to the clients. And then I had the stash at home. I actually had to dip into the stash at the house. So things were really desperate. Chris, where are you? Joy, Sandra, Barbara?
Hi, good evening. My name is Barbara.
Hi, Barbara. You're
How are
home.
you?
It's nice to see you. Hi, Chris. Hi, Joy. So
Hi.
we are going to jump right into the questions.
So I'm just going to ask a question or two for you. I know that you are absolutely part of the pandemic angels, out there doing things, helping people, being in people's homes, got out there when others didn't want to be, and you were showing up. So the first question I'd like to ask, I guess I'll ask this to Chris. Do you feel your role during the pandemic was important to keeping people safe?
Yes, I do. Reason being, I had the vital job of issuing items such as face shields, masks, gloves, PPE equipment to all of the aides with our home care. I also purchased groceries at the grocery store and hand delivered it to the clients at home.
Sometimes till 10 o'clock at night.
Sometimes till 10 o'clock
Out
at
there
night.
delivering groceries.
It
Yes.
was a heavy task, but we made it through.
So, Joy, did you work during the pandemic? Wait, we gotta let
Unmute.
Tiffany's gonna unmute you.
Oh, I have, yes, I was working during the pandemic. I was one of the blessed people who's never lose their job. And I would say thank you to God and for my Beacon family too.
Thank you very much. So, Joy, you are bilingual, yes?
Yes.
So, can you introduce yourself again? And which language are you going to speak?
I'm going to speak Tagalog. This is a Filipino language. It's a Philippine language. So I would say, I will greet in my language. Magandang gabi sa inyong lahat. Ako si Joy Torres and I work for Beacon Elder Care. My name is Joy. Good evening to everyone. My name is Joy Torres and I work for Beacon Elder Care.
Okay, thanks.
My next question will be for Barbara. Do you
Barbara?
Barbara, you there? Okay. Can someone unmute Barbara?
It's Tiffany. Or we.
Unmute yourself. I'm trying.
Oh, she hit the button.
Okay, we can go to
Little
Sandra.
technical glitch, guys. Don't worry. Hey, Barbara, click the mute button. Okay, good.
There you go. So do you feel that your company had provided you with proper amount of safety equipment in order for you to be able to work?
Yes, they did. I feel that the company provide enough safety equipment for us. So they did.
Okay, did you feel safe while you were working with the clients, Barbara?
Yes, I feel safe. Yes, I feel safe. The client said she feels safe and she thanked me for being there and helping her a great lot. That people come to meet out to her and she tell me the most thing about her. She said to me that one thing I like about you, you always keep God in charge. She said to me. I said, yes, I always put God in charge. I will always tell her, God in charge and all is well. We're gonna get through this together, no matter what happens.
All right, that's very positive thinking. Now, Barbara, we can't see you, by the way. Sandra, can you, we need to see you and unmute your mic, Sandra, because we would like to know one of the stories that you have with working with your client during the pandemic.
It was very good. I'm working with them. It was safe for me because Beacon Elder Care provide all the necessary PPT equipments that manage of Beacon Elder Care, provide a safe environment for us to work in.
Okay, thank you very much. Chris, do you want to tell us what one of the shining stories was about the pandemic from a client?
Yeah, sure. One of my shining moments was when I delivered to my client and I saw the smile on his face. He was very appreciative of our company for delivering groceries and also, you know, just at the risk of our safety. Um, but just the gratitude they showed and the appreciation was overwhelming for me because again it was very rough and it was at my risk, but we do it because that's what Beacon Elder Care do. My boss, Miss Yvonne, she made us safe and equipped to do the necessary job that we were doing at our risk, but it was well worth.
Thank you. Thank you very much, Chris. I want to take this opportunity, because we're getting on in the show, I want to take this opportunity to thank all my staff and say hello to the employees that have joined us this evening. All the Beacon Elder Care employees, can you click the raise hand button? I want to definitely say a special thank you to Camille Hellinger. She's the director of our home care department. And I'm just going to run down the employees because I can't see you. I want to thank Estife and Joseph and Stephanie, who's likely watching, and Maria. I want to thank Lisa, who works the front. Oh, there's Lisa. Hi, Lisa. You're welcome. I want to thank Marcia Warner, who's also on the line. Marcia has been working for the company since 2006 when I first opened the doors. And she is our pinch hitter whenever we have a very important VIP case. We pull Marcia from wherever she is, and she's the first face that you see. So we want to thank you for that. I also want to, Beverly Buford is on, and she also has been working with us since 2006. And Beverly, we had a very difficult patient years ago, and Beverly was the employee that was staffed to that case, and the client would grab your hair and pull your hair because they were cognitively impaired. We didn't think we'd be able to keep the case. We were going to tell the family members, look, we can no longer provide service to you. And then Beverly shows up at the office, and guess what she did? She cut all her hair off. So my employee cut all of her hair off so that she can continue to provide service to that client. And she stayed on that case for 8 years. So thank you very much to you for
That
that.
is really an amazing story, Yvonne. That's
Absolutely amazing.
That's dedication and devotion.
Thank you. So we're, so
we announce the winners?
yes, I would like to do that. Let's do it. We've got winners, 3 of
The
them.
winning numbers were 3, 7, and 9. And Lisa Nappi had 3.
Yay, Lisa.
Hayden, oh, there we go.
Yay.
There's our 3 winners. So please contact Tiffany, send her your contact information so that she can follow up with you to make sure we get you your gift cards. Okay.
So I want to thank the Beacon staff for joining us this evening and explaining to everybody the integral work that you did during the shutdown. I appreciate you all. I most certainly couldn't have the business and great reputation that we have in the community if you all didn't work so hard. So Andrew, you want to talk about our next show?
Absolutely. I also want to say thank you to the Beacon staff because
Thank you.
your staff was really out there on the front line. It's really amazing. You know, during the pandemic, we also offered healthcare proxies and powers of attorney to all first responders and healthcare workers. So we were doing our part as part of being estate planning and elder law attorneys by providing some of those people who were out there putting their lives in danger every day, giving them some peace of mind for themselves of having some of those documents. And thank you. Congratulations to all of the winners. And we'll be, please get in touch with Tiffany via chat here so that she understands where we have to reach out to you. So our next show will be August 26th, 2021. And the topic is going to be what's going on in the senior centers and in our senior community. We're going to have some really great guests then too. We're going to take a look at the different things that you have put into the chat as far as topics that you want us to talk about. Again, if you please put in to the chat box some topics that you'd like to see us talk about. And
so Andrew, our next segment is going to be August 26, 2021, so at 7 o'clock. And we will have that up on our social media. And we are going to have a show that deals with the seniors and what's going on with the seniors in the senior community. And we want to remind everybody to write their suggestions in the bar below. And we will put our survey up, but I want to just close by saying Beacon Elder Care thanks you for joining us this evening. We feel privileged that you've shared your evening with us tonight. I know how precious time is. I think we have all realized how precious time is during this last year. We are literally here today and not here tomorrow. We've imparted valuable information to you this evening, and knowledge is power. And you don't know what you don't know. So contact experts like Beacon Elder Care to guide you through the elder care maze. We need to have an understanding of how generational wealth is passed along. If we don't set our future generation up for success, they will literally be starting from nothing, clawing to the top of the ladder of success every single generation. So don't let this happen to your family. Contact us here at Beacon Elder Care, 718-406-9500, extension 100 or 718-406-9500. You can also email us at info@beaconeldercare.com. That's info@beaconeldercare.com, and visit us on our website at www.beaconeldercare.com. And most importantly, please like us on Facebook. I have 403 followers, and I'm trying to get to 500. So everybody get on Facebook and like that button. Follow us on Twitter and Instagram. And don't forget, if you missed any part of this show this evening, you can check us out on YouTube. The show will be posted there tomorrow. And please subscribe to the YouTube channel. That way you will get information on upcoming shows. Thank you again to all my staff. I think my daughter Ariel is also on the line. So thank you for being here. Hi, Benjamin. How you doing? Thank you for being here. Hi, John. How are you, John? Let me see who else I can see here. I also want to thank Cashmere, 100% Cashmere, because they are the company that did my makeup for this evening. So please feel to reach out to 100% Cashmere at 347-830-5436. So John has a before and after picture of me up there. Oh, great job, John. Okay, Andrew.
Yes, I have the after and after picture.
You have the after.
Right, here's the after and after picture. Thank you all for coming tonight. Really, we're really honored that you took the time out to come, because you can do a lot of things and you chose to be with us. So that's really, really awesome. And thank you very much. We are the Estate Planning and Elder Law Group. We are located in Glendale, Queens at Myrtle Avenue and Cooper Avenue, 71-27 Myrtle Avenue. Our email address is info@aljlaw.com. And we've been doing this for a long time. We have expertise. We have the ability to provide you peace of mind. Why worry whether or not that generational wealth will be passed on? We can show you how that will work. We'll help you saving taxes, also saving the family taxes by doing it properly, and making sure that you protect what you work so hard to put together. It's really, it would seem to be really unfair to allow, just, procrastination and being lazy, really create really negative effects in your life. We have workshops all the time. We give out a lot of information, and we're here to help our clients. Our clients are everybody who has a pulse, pretty much, because estate planning is for everybody. When you're 18 years old, nobody has any ability to help you legally unless if you give it to them. So when you turn 18 and go away to college, leave your parents with the power of attorney and a healthcare proxy, because you never know what happens. You never know. You just, as Yvonne has pointed out, in the blink of an eye, things become different, and then your life can change forever. If you have plans in place, you have a much better chance that things work out okay. And it's really great. I thank you to our sponsors. Thank you, and our congratulations.
Dough Donuts, Central Florist, Good Eats for donating the $50 gift card, and John Sanchez with the Queen's Ledger. John, if you can unmute and unveil yourself.
Unveil yourself, John.
You like that, do you? John, thank you so much. You're the one that brings everything to life. You're the one that gets everything out there on social media. Everybody out there, if you haven't checked out the Queen's Ledger and their website, John, you can speak for yourself.
Well, I'm very fortunate to work with just amazing local businesses. We're always looking to work with new businesses, looking to help the community. If you have a story in relation to the pandemic, or just have a good story to tell about the community, please shoot me an email, john@queensledger.com, and we'd love to help tell your story.
Okay, great. Okay, so thank you, everybody. Don't forget, Beacon Elder Care has home health aides, home health aides, home health aides, home health aides. And Andrew Gelosa is your attorney that can assist you with your estate planning and keep your family's resources safe. So thank you very much, and we will see you all next month.
See you in August.
See you in August.